All right. Thank you all so much. I'm Dr. Lisa Patel. I'm the Executive Director for the Medical Society Consortium on Climate and Health. And this is our first ever Our Planet, Our Health Climate Action Convention. When we first started planning this last summer, we did not know the ride that we would all be in for, or I think how much we all needed to come together in this moment, particularly when we're facing so many forces that are aiming to pull us apart. I'm the daughter of immigrants who started their life in America in New York City in the 70s. My parents worked their way south, and we eventually settled in Houston. When I was about 10, we returned to New York, and my parents were going to visit their old friends. And one day, my parents split up. My father went to go see his colleagues at his old hospital. My mom took us to go sightseeing, but we got lost. She lost her wallet along the way. Now, if we were easy children, this wouldn't have been a big deal, but we were horrific brats. And so we were whining, we were tired, our feet were tired, we were hungry, we wanted to get back to the hotel now. So my mom slipped into a donut shop around the corner, I think just to get her bearings. And as we walked in, we saw a Sikh man who was behind the counter, who was walking us in. And I looked at my mom, and it looked like she was about to turn and head back out the door. Now, to give you a little background about this, the Indian diaspora is really complicated. Groups are divided by religion and geography and caste in India, which at times carries over to the US. And I certainly felt that growing up in Houston. The only people that we socialized with that were Indian in Houston came from the same part of India, from the same religion. Hindus and Sikhs felt like we were two worlds apart. Well, as my mom turned to leave, the man asked if the kids wanted donuts. And my mom said she'd lost her wallet, she'd lost her way. She couldn't pay for the donuts, but could he help her find her way back to the hotel? And he smiled and he said it didn't matter that she couldn't pay. In this city, he was her brother and she was his sister. And if they didn't have each other's backs, who would? He gave us all free donuts. He called a cab and provided the cab driver the fee to get us back to the hotel. I thought about that story a lot as we were seeing the registrations come in and the emails of folks asking if we could make additional space. There are times when I wake up and I don't recognize our own country. I feel like a stranger in a strange land. But then I look out at everyone here, our climate and planetary health family, who reminds me that whatever is happening out there, we have each other. And this, to me, feels like a family reunion. The day is likely to be crowded. We invited too many people. There will be the equivalent of an overbearing relative shouting instructions at you at various times of the day. But we also couldn't do without every one of you. And we all have each other's backs in this room. For the challenges we're facing, standing united has never been more important. I want to take a moment in terms of standing united and just want to acknowledge our planning partners. So for our planning partners and collaborating organizations, folks that were part of the planning committee, if y'all wouldn't mind just standing up so we could give you a round of applause. I want to thank the American Lung Association. Stand up. I see you. Stand up. So thank you so much, the American Lung Association, American Public Health Association, Eco America, Kaiser, National Academy of Medicine, Physicians for Social Responsibility, and Planetary Health Alliance. We also had wonderful help from Alliance of Nurses for Healthy Environment, the Global Consortium on Climate and Health Education, Healthcare Without Harm, Climate Advocacy Lab, Climate Psychiatry Alliance, the Journal of Climate Change and Health, the New England Journal of Medicine, and Medical Students for a Sustainable Future. So thank you. I also wanted to take a moment to acknowledge our sponsors, Blue Shield of California, New England Journal of Medicine, and Senator Bill and Tracy Frist, in addition to the University of Colorado Diploma in Climate Medicine, AAMC, the New York Giants, the Barb Ernie Stanford Climate Education Fund, the AAP, AMA, Research America, Sierra Club, Elevance Health, National Association of Social Workers, Natural Resources Defense Council, Warren Levy, Union of Concerned Scientists, Migraine Doctors, and the Pediatric Associates of Alexandria. Thank you, thank you. We could not have done this without your support. The last folks that I want to just take a moment to thank, as one of my staff members said, we, and by we, she meant me, have eyes bigger than our stomachs. And so pulling off an event like this was no small feat. But my staff collectively spent thousands of hours planning this event and pouring their blood, sweat, and tears into this opportunity for community. So Nicole, Savannah, Bev, Kimberly, Lucy, Clarissa, Shanita, Dan, Vicky, and Mo, thank you, thank you. And to our event planners, Lindsay and Hannah, we all owe you a huge, huge debt of gratitude. With that, I am going to, we had Governor Tim Walz provide us some brief video remarks. So I'm going to hit play, I believe.
Hi everyone, Governor Tim Walz here. Here in Minnesota, we recognize that climate change crisis is a public health crisis. We've watched disasters influenced by climate change devastate parts of our country over the last decade. We've seen people in California and Oregon suffering from poor air quality from forest fires, people dying from extreme cold in Texas, and people suffering from lack of access to clean water and medical care during hurricanes in Puerto Rico and Florida. These things are all intertwined. Climate change itself does not hurt people, but its effects do. Extreme temperatures, extreme weather, extreme natural disasters. These are all the things that hurt people. And when people get hurt, it's health professionals that step up and help. Not only do health professionals stand on the front lines of these disasters, but they're also the trusted voices on the ways that climate change is impacting health. As a nation, we've made a lot of progress on cleaning up air quality and water quality. In Minnesota, we're proud of what we've done to keep our air and water clean. The Legacy Amendment ensured that there's an ongoing funding source to keep our water clean. In 2023, we committed to 100% clean energy by 2040, and we banned forever chemicals like PFAS. But we're still aware that changes in our environment are accelerating. What used to be a simple issue has become hyper-partisan, but it's still possible to move forward. Congress passed large investments in clean energy, clean transportation, and community programs that are already working to lower emissions, improve air quality, and foster innovation. When we stay focused, we can keep moving forward to fight the type of world and leave it the type of world that we want for our children. Thank you.
Now I'd love to turn it over to Elise Hall from the American Indian Society for our land acknowledgement. Elise, thank you so much.
I have a very loud voice, so I hope I don't blow your eardrums out. First, I want to thank you. It's an honor for us to be here. Before we begin anything in our cultures, we do not consider these are the Americas. This is Turtle Island to the Native people, and it will always be Turtle Island. To do a land acknowledgement is a wonderful thing, but we are spiritual people. So first we give honor to the four directions, and then to above as below. You are in the center. We say the differences in people. Are there differences? We breathe, we walk. We say land acknowledgement. We acknowledge, but we honor those who were here 1,000 years ago and are still here. The Piscataway, the Kanoi, the Anacostia, the Shawnee, the Lenape, the Tutelo, the Doeg, and many more, because they traverse these lands, as you do right now. And anywhere you go, anywhere you touch, you leave spirit, you take spirit. The land that you walk on cries out. It has the blood, the sweat, the tears, the dreams, the hopes, the fears of many, many, many people. But now we stand in 2025 and we are coming together. You are the healers now, and we are honored to be in your presence. You are now going to be the people who are contagious. And you're going to see that people who once ignored you are now going to run to you. They're going to revel. They're going to be at your feet. What can we do? Because as we see, and no one can be blind, that we have allowed destruction to come. You are the healers. Everything that you need out here has been provided. I honor grandmother Sheila. I honor my sister Phyllis. She didn't have to get up this morning, and as an elder, she only does what she wants to do. Believe me. So with that, we were told 50 people. Oops. So with your, I'm gonna step away from the mic, but I probably won't need it. I'm going to ask grandmother Sheila if she would pray. I will not hold you hostage because believe me, as an instructor and a teacher, I know my students are like, So I asked grandmother if she would bless these. These are our prayer ties. And if you take one, if you have one, what it is your six senses. People say five, we say six. We all say six because as healers, you know that sixth sense will tell you where to go, what to do. As you see, all of the people who have come out to support you and sponsor you, we also support you. The prayer tie, when you take it, your first is touch, smell. I know you know that. I'm looking at you though. Like my student, I'm looking at you. Okay. You can make a tea from it, but that's medicine and it's bitter. Okay. Hear it. What's in there is the medicine. It's the medicine of the peoples of this globe. We have been donated things from Australia, Europe, Asia, and right here on Turtle Island. And we would like to gift this to you. You are now standing on the precipice of creation of a different sort. You're going to heal what has been not destroyed, but taken for granted. And we thank you for that. We say, Banasheta. With that, we are spirit people, so we say, Nayane, no, no, yeah, no, yo, yo. Banasheta, we thank you.
Like I was saying, it's about those who have been here before us. We're walking in their footsteps. Like Allie said, whenever you walk on this earth, you leave a little bit of your energy. And those energies are all around us. I printed off last night, got online, believe it or not, and I did the indigenous tribes in Virginia from the 1600s. They're tribes I never heard of. It's like, oh my, we'll never know. But we do know because we feel them. And I welcome them into this room this morning. I thank everyone and honor everyone for having us here to honor the earth and to honor the ancestors who have walked before us. So what do we do with our time on this earth? What are you doing with it? What are you doing with it? Are you having fun? Are you laughing? Are you enjoying one another? Are you helping one another? Are you present? So let's take a moment and reflect on that. And I'm going to take a moment and then we're going to pray over these prayer ties. And then I want you to reflect on yourself, not the person beside of you, not the person that you thought you might be, but the person you are. This day, this moment. Creator, Thank you for this beautiful day. Thank you for all the blessings that you have given to us. Thank you for our Mother, the Earth. Thank you for the opportunity to be in this life and to walk this road and to enjoy all the blessings that this earth has given us. Help us, Creator, to walk gently and only leave our faint footsteps on this earth and nothing more. Thank you for the blessings of our family, for this institution, for the teachers and the faculty that make up this institution, and most of all, for the students. Help us each day to be better human beings. Ahome Takwiasi.